Hello, my name is Dr. Celia Kucera, and I am an OBGYN physician at the George Washington University Hospital in Washington, D.C. Here are 5 things that your gynecologist wants you to know. Number 1 is to get your pap smears. Pap smears are the screening test for cervical cancer. Regardless of your sexual activity, we recommend starting pap smears at age 21 years old. If you have normal pap smears, you only need them every 3 to 5 years, depending on your age. If any pap smear is abnormal, you may need screening more frequently or confirmatory testing with your OBGYN. There's also a vaccine called Gardasil, and it's against the human papillomavirus, or HPV. It's the only vaccine that has been proven to prevent cervical cancer. If you are less than 45 years old, I recommend you ensure you have gotten your vaccine to protect yourself. Number 2 is to practice safe sex. Talk to your OBGYN about contraception options that may be right for you to prevent unwanted pregnancy. There are many contraceptive options, like the pill, the ring, the shot, to longer-term options like the implant and the IUD. There are also permanent sterilization procedures for both men and women that are safe and very effective. The most effective forms of birth control are the arm implant called Nexplanon, any of the types of IUDs, both copper and hormonal, and surgical sterilization. All of these methods have a less than 1% chance of unwanted pregnancy. Methods like the pill, the patch, injections, or ring have about a 6 to 12% chance of unwanted pregnancy with perfect use. Condoms and cervical caps have about a 20% chance of unwanted pregnancy, and cycle tracking or the withdrawal method have up to a 20 to 30% chance of pregnancy. The only contraceptive method that also protects against sexually transmitted infections are condoms. Make sure you are getting STI testing if you have a new sexual partner or have any concerning symptoms like pelvic pain or abnormal vaginal discharge. Number 3 is to have breast self-awareness. It's important for women of all ages to know what their breasts normally feel like and to be aware if any new lumps or bumps arise. For most women, we recommend starting mammograms for breast cancer screening at age 40 to 45 every 1 to 2 years. If you have a strong family history of breast cancer, talk to your doctor about earlier mammograms and if they're necessary for you. Number 4 is to keep track of your periods. Normal periods are 21 to 35 days apart, with only a few days of variation between cycles. Periods normally last for 3 to 7 days, but certain conditions can cause abnormal menstrual bleeding. If you are going more than 3 months without a period, you need to see an OBGYN to rule out pregnancy or other concerning problems that can arise when you don't have a period. Also, if you are bleeding for longer than 10 days or having intermenstrual spotting, see your OBGYN for further management and treatment. Getting a free app on your phone is a great way to keep track of your cycles. And number 5 is to maintain a healthy weight. Maintaining a healthy weight with a balanced diet and daily exercise is important for your general health and your reproductive health. Weight gain or weight loss can negatively impact your periods and ovulation, and being obese is a risk factor for multiple gynecologic problems for things like fibroids, prolapse, and even some types of cancer. Talk to your OBGYN or your primary care doctor about your weight at your annual visit. I hope these 5 things help you in taking care of your reproductive health. Stay well.